are you?
Good.
My son's cracking us up. Sorry. And, I just got off the phone with Dr. Shields.
Did you?
In Reno, just ago. So we have a little more clarity about what's going on over here. So we looked at this biopsy, which was just done, and our pathologists are not calling it what the renal pathologists call it. They're calling it the same kind of Hodgkin's you had in Oregon. Correct. And the reason for the confusion is because it's the lymphocyte-rich subtype.
Okay.
Which was, and we looked at the one from Oregon also.
And
So now-
compared them?
Yeah.
They're the same.
They're the same.
Okay.
Okay.
So that's a little more difficult.
Well, not difficult, but it's at least the treatment can now be the more correct treatment because
Right.
the treatments are so different between the two.
Right.
So if you have to sort of think of this, so you had this 8 years ago almost, and it's a little unusual for it to come back 8 years later, but it can happen.
Okay.
And so where all is the disease? It's basically on both sides of your neck, and
It is.
it's on the PET scan we did here. It's on, they're small nodes, but they're on both sides. Your spleen essentially they've sort of waffled a little bit. They say it's slightly bright, but it could be a nothing versus it may be lymphoma, which is again, they don't know you as a patient. They've only looked at all the history and something. So at the practical level, this looks like early stage just here and here, which is called stage 2. Now you've only had 6 cycles of ABVT,
Right.
okay? And depending on when the Hodgkin's comes back, like if it had come back within the first 5 years, the treatment is okay, give chemotherapy and go to bone marrow transplant.
Right.
But once it's so long out and it's early stage, you almost can consider treating it as a new diagnosis
Okay.
rather than pushing you to transplant, which is sort of one
Which
end of
is
the spectrum.
Good, yeah.
Okay, and so that's what I was talking to Shields about. That the limiting thing is how much more adriamycin you can get, that ABVD. You've only had 300 so far, and the safe limit is 450. So we have room over there to give you more. So there's a recipe for how you got ABVD. We developed something here called Stanford 5. Okay, so that's another chemotherapy regimen, but you can get that for 8 weeks. It's every week for 8 weeks, and it will only add 75 more of atria.
Okay.
So it's still well below the 450 threshold.
Okay.
But what it will do is it's chemotherapy every week, and then after you're done with that, it's radiation to the neck over here. And all that can be done in Reno.
Good. Okay.
Okay, and I wanted to make sure Shields was familiar with that, and I just got off the phone with him, and he said, yep, we know that, that's not a problem. But I told him to wait till Monday, because on Monday we have our tumor board, where we look at the pathology and we look at the scans and everything with the radiation person in the room and everybody in the room, and we'll all be there and powwow it with 10 people in the room as to what makes sense. And I think they will agree with this approach.
Okay.
But so it would be you would get the chemotherapy over there. I will have you come back down here for a scan just so that we can compare
You
apples to apples.
Right.
And then if everything looks good, I say, okay, give you the blessing for the radiation.
Okay.
So that's kind of what we're looking at right now.
And how long would the radiation be?
The radiation is for about 3 weeks to 4 weeks every day, because they give you little doses. They don't give you a big dose.
Okay.
Now also, there are certain regimens, like there's something called, there are certain regimens we can use even without radiation. There are certain regimens where you can just get as low as 20 gray radiation and just as little as 2 cycles of ABVT. Really very minimal therapy.
Right.
So we could even get away with that, but I want to look at the scan. So if we just do the 2 cycles of ABVD, which is 4 treatments, that's for what we call the HD10 trial, German Hodgkin's Study Group, HD10. So that is for upfront diagnosis, but you're sort of approaching this that way after such a long interval, okay? HD10 trial, and you can find the reference from here. Yeah. You get 2 of ABVD, which would just add, that would be how much of that's 50, that would add 100 more of adriamycin, which is still a little more than she would get with Stanford 5. But her radiation dose could be as low as 20, assuming her ESR and all is okay. So there are certain blood tests you haven't had, and what I was hoping to do is at least have you have those today on your way out, so that I have complete information on these other parameters. Okay. So you might as well check the hepatitis, HIV, assuming her insurance covers it all. CBC, MECOM, ESR, and everything, so that then we can just fax it to Reno, so that they don't have to repeat all of that there. Okay.
How much chemo do you think, or how long will
It's
that?
about 2 months of chemo.
It's not bad.
No, it's not bad at all. In the meantime, when have you had your teeth cleaned last?
So I went on Monday
Yeah.
and they did 2 fillings, and on February 1st, then they're doing the deep cleaning.
Perfect, and this is, and that's fine, let them do that and we can start chemo after that.
Okay.
Because this is, nothing is massive in on your scan, it's all pretty small disease, so you can wait to get it all
So,
taken care of.
right,
Yeah.
right, okay.
Yeah.
Okay, good.
Okay, and we will call you, I will call Shields, and between Alfred and me, we'll call Shields and we'll call you
Okay,
to go over the final plan, but it
Okay.
looks like 2 months of chemo. Whether it's ABVD, whether it's Stanford 5 is
Right,
we'll decide,
okay,
and followed by some radiation, assuming that on the tumor board we get a consensus.
okay,
Okay,
okay.
so that's kind of where we are.
Sounds good.
We have a plan.
Yeah, we have a
Okay.
plan, yeah. And what caused the delay was I needed a pathologist to weigh in.
I
And
understand now
Yeah.
why.
And
You're
they need
right.
to look at the site, and they got the case from Oregon, they got the case from Reno, and looked at both together.
Okay.
So.
Okay,
Okay?
all right, thank you.
All right, so sorry it took so long to get all the
That's
answers, but
okay.
we have a plan, and I
Yeah.
think we have a good plan.
Okay,
Okay?
Awesome.
And the good news is they can do it there.
right,
Right.
right,
Yeah,
Yeah,
and
we have
that's why I
two kids
talked
at
to,
home,
exactly,
so-
I talked to Shields directly.
good,
And he's given us his cell phone number to reach him on Monday, so
okay,
All right.
perfect, thank you
All
so
right.
much, all right.
take care, my dear,
All
stay
right,
well.
I'll see you
stay
for
well.
a
The
scan
scan again.
and,
Yeah, yeah, yeah.
okay, before radiation?
Yes, absolutely.
Okay,
Thank
thank
you.
you so
Sure.
much,
Take care.
awesome.
Sure.
All right, so just go ahead, labs.
Yes, so you